Hey, Margie here. Unfortunately, many people suffer with allergies and asthma, and this can have a negative effect on their bones. But the good news is there's many things that can be done besides conventional medicine and shots to improve these conditions. And that's what we're going to focus on today with our very special guest, Dr. Darin Ingels. And Dr. Ingels is a licensed naturopathic doctor, international speaker, and leading authority on nutritional medicine. He is the author of The Lyme Solution, a 5-part plan to fight the inflammatory autoimmune response and beat Lyme. He's a former Lyme patient who overcame his own 3-year battle with Lyme disease after having failed conventional treatment and became progressively debilitated. Dr. Ingels found that proper diet, lifestyle management, and natural therapies worked with his body to heal instead of against it. He then applied what he learned to his own patients and found they recovered faster and with less side effects. He now has treated thousands of patients with chronic illness using his novel approach, many who have gone on to live healthy, symptom-free lives. And today we're focusing on allergies and asthma because the good news is there's so much that can be done. And this interview is just full of a lot of information and takeaways. So stay tuned. Welcome, Darin. It's so great to see you. Thanks so much for joining me today.
Oh, well, thanks for having me back, Margie. I appreciate it.
You know, people don't realize how important this topic is, but after what we're going to talk about, I think they will. Let's actually start because we're going to talk about both asthma and allergies, since those are two areas that really have an impact on our bones. But I don't think people realize that there's a connection between, allergies, if you're a person that has all sorts of allergies, and bone turnover, meaning people are losing bone because of this. So do you want to share the research and why, if we do things to improve our allergies, we can also improve our bones? I think this is so fascinating and sort of exciting because more things that we can have an impact on.
Yeah, I think it seems like kind of a wild disconnect, right, between, someone who gets hay fever and asthma and the drippy nose and watery eyes. What on earth does that have to do with my bones? And what we're finding in the research is that people who are disposed to allergic illness, so again, this can be allergic rhinitis, this can be asthma, there could even be something like eczema, that there is a very complicated immune mechanism that I won't even begin to try to explain. But basically, when you've got an allergic disposition, there are things that change in your immune system that ultimately affect your bone turnover. So essentially, the more allergic you are, the more impact it has on your immune system, and ultimately that can cause more bone loss. So the net effect of that is osteopenia, osteoporosis. So it really is an indirect relationship, but as we start thinking about what can we do to improve our bones, in addition to helping protect your bones, we're also doing a lot just to get rid of these nuisance allergies, which for a lot of people just makes their life absolutely miserable. The chronic, nasal congestion and head pressure and difficulty breathing, that by itself is very problematic. But, the tie-in here is that, when you have that disposition, and a lot of that disposition is genetic. And I think we talked about this last time, but we know that if one parent has allergies, there's about a 25% chance that the child's going to have allergies. If both parents have allergies, that goes up over 80%. So there's certainly a genetic disposition, plus, the clinical symptoms. And then again, we'll talk a little bit in a minute about medication, but if you're on certain medications, that can just kind of add to the load and proceed, the bone loss is even more rapid. So, if you're someone who, is suffering from allergies, there's a lot of things we can do to mitigate that. But again, the back end effect of that is that it could be wearing down your bones and you're just not aware of it.
I think people know about the asthma and we know about the medications and the corticosteroids, which we're going to go into. But truly, that's not something that I was aware of. And I don't think it's on anything, if you have allergies, when you're doing risk factors for osteoporosis, allergies. So that is really that's new to me, quite honestly. But the good news is and we're going to talk about things that people can do for that. But yeah, how interesting. And if indeed it's increasing your bone turnover markers, the good news for that is that you can measure that, even every 3 months with the CTX, so you can see besides your
Right.
allergies improving, your bone turnover markers are improving. So that's such a win-win. Okay, let's also get into then, do you want to talk let's talk about some of the other problems with allergies, and then we'll go into, because you treat this differently. I mean, that's what I love, is that you have, a lot of people aren't aware of, there's a lot more that can be done than just going on the medications. But what happens with some of the medications for allergies, and how come that increases the risk of osteoporosis?
So, if you look at the medications, primarily it's usually, there's a few different classes of medications, but we'll start with the antihistamines because I think they're the most common. So things out there like Zyrtec and Claritin and Allegra and Benadryl, these are what we call H1 antagonists. And we know from these medications, it's actually pretty interesting. There is some conflicting data in the research about these medications. There are some studies that actually suggest that people who take these medicines actually protect their bones. And then we've got other studies that suggest that they might cause bone loss. So I think the jury's kind of still out about the net effect of long-term use of antihistamines. I think what's always really fascinating, and this is probably true for just about any drug out there, and if you're the kind of person that geeks out on this stuff, it's interesting to look at, when you look at any drug, how long did they actually study the drug in the initial studies to get it FDA approved? And it's amazing. I'm just going to pick Prozac because it's one I always remember, which has nothing to do with what we're talking about today. But the initial study on Prozac was only about a month. That was it. And the FDA approved it. And so the data of using that kind of drug, when now people are on this kind of medication, it's an SSRI, for months and even years, we really don't know what these kind of drugs do when you're on long term because they just don't study it that way. And, it can be true for antihistamines too, that, we study it short term to kind of figure out if there's any toxicity, is there any clinical benefit, but, doing these really long-term multi-use studies often don't get done. So, is there any potential negative effect on bones? Again, at least according to the literature, it's with the H1 blockers, so the jury's kind of still out. Now, there's another set of antihistamines called H2 blockers. These are things that are mostly used for gastrointestinal problems, things like Pepsid and so forth. And they definitely, the literature is very clear, they definitely have a negative effect on bones. For people who have these chronic, stomach issues, heartburn, reflux, and they're taking these kind of medications, again, we know over time that will lead to, sequential bone loss. So the H2 antagonists, definitely a problem. The H1s, we're kind of, not quite sure yet. And then, we look at drugs like steroids. So, a lot of people, particularly with asthma, are using some sort of inhaled steroid. Your pulmonologist or allergist will tell you that if you take a little puff every day, that's going to prevent you from having an asthma attack. And I think initially, we always know about oral steroids. High dose oral steroids have been associated with bone loss, and we've known this for many, many years. But it was always kind of thought, well, the inhaled steroids, because it's going really primarily to the lung, it's not going throughout your whole body like the oral steroids, or even like the topical steroids, like we use, hydrocortisone for eczema and things like that. People I think used to believe that, well, it's just a little bit and it's not a big deal. But again, we've now shown in the research that that long-term use, that little dose you get every day, can suppress your immune system, can interfere with bone growth, can interfere with growth in children. So we do get negative effect from the steroids long-term. Now, how long is long-term? I think that's going to vary a lot from person to person. So are you on it for a few months? Is that going to cause bone loss? Probably not. I suppose this is probably something that takes a matter of months or years to develop. But nonetheless, if we're really interested in being healthy, protecting us in every way possible, and certainly protecting our bones, as much as we can do to start changing the immune system in a positive way that you don't have to rely on any of these medications to control your allergies and asthma, that's a win.
I always worry because I see young children from a very young age have that, it's really changed from what it used to be. How many people
Right.
now are on these medications or on the inhalers? It's just not uncommon to have a group of young children on inhalers and different things and on having asthma. And, I guess you can tell us why that is, but I just worry about what's going on with their bones because they are on it for a very long time. And, it's not something that's really going away. And typically a lot of people just keep them on the inhalers as needed. So I think it's a very big risk factor. Steroids are a huge risk factor for osteoporosis. And so I'm really glad there's another way. So before I ask you about that, I just want to say just the asthma and the allergies, though, themselves, that impedes exercise. There's so many things that by just having those
Right.
that can affect our.
Absolutely. And if we're talking about, the things that we know help build bone, that's, exercise, movement, moving weight. And for a lot of people that have allergies and asthma because they have difficulty breathing, because they feel congested, and allergies alone can actually make you feel very fatigued. So if it's a high pollen day and you're feeling more allergic, you're probably not going to be as motivated to go outside and go walking or ride your bike or do other types of exercise that might actually be good for your bones. And so, yeah, we've got the secondary factor that people probably tend to be a bit more sedentary when they don't physically feel well, or they don't feel like they can exercise to any degree without having an asthma attack or getting all congested and stuffy. So as we control that piece, again, it frees people up to be able to do that physical movement that's really important for bone growth.
All right, Darin. So here's the key, which I'm so excited that you're here because you are truly an expert in this and you've been doing this for so many years. So you know what works. So the good news, everybody, is there's other ways besides the medications. So it's a very big topic, but do you want to just maybe share some of the highlights of what people can do?
Well, if we really want to get to root cause medicine, there's a lot of things in the natural world that we can do to, affect allergies. We have natural mast cell inhibitors. We have things, and for people who don't know, mast cells are the cells in the body that release histamine and really over 200 chemicals that can cause various physiological effects. Histamine's the big one. But, histamine is actually very important for regulating bone turnover. People don't realize that histamine's a good thing. We want histamine. We need histamine. It's an important neurotransmitter for our brain. It's involved in bone turnover. It does actually a lot of good things. It's just when it's excessive or our body has difficulty with the histamine, that's where we start getting into these issues. So again, if we can put a Band-Aid on the problem by, things like vitamin C, nettles, quercetin, luteolin, there's a compound called PEA. These are all great mast cell inhibitors. So if you think about a mast cell being kind of like a balloon, and inside a balloon, there's all these little granules. If we can stop the balloon from popping, then that stops a lot of this chemical interaction that happens once the balloon pops. So if we can prevent that from happening, we can really mitigate a lot of allergic responses and asthma. And it's a great strategy. And initially, when we're working with folks, we like to use these things because other things we might want to do are more long-term, and it might take a while to really affect the immune system. So it's nice to have that stopgap treatment that's going to help people feel comfortable, again, without having to rely on their daily Zyrtec or inhaler. So I'm all in favor for using these things. And I should qualify this. I'm certainly not suggesting that you should never use an inhaler. You should never use antihistamines. There are times where they are absolutely necessary. And my gosh, if you are having an asthma attack, please use your inhalers. If you have uncontrolled asthma, please use it because it can be life-threatening and very dangerous. But, once we get to a point where you're feeling more stable, then we can start weaning you off the medication and hopefully get to a point where you don't need it at all. But again, if we really want to get to the root, using immunotherapy is probably the most effective way to literally permanently change your immune system so that you stop reacting to whatever it is in your world that bothers you. And I think most people, if we think about immunotherapy, the conventional way is allergy shots. If you go to an allergist and they think you're allergic to different environmental triggers like mold or pollen or cat or dust, they would either do skin prick testing or they would do blood tests to verify that this is the trigger for you. And then based on that, every week you would go in and they would inject you with just a little bit of the thing that actually bothers you. And then over the course of time, they slowly increase your dose a little bit with every injection. And then you get to a point where you're on a maintenance dose. And once you're on that dose, you're usually on it for many, many years. Conventional allergy shots can take anywhere from 3 years, maybe as long as 7 years. So immunotherapy is definitely a long game, but it does have the potential to get to a point where we rebuild your immune tolerance to the point that, again, you don't have these allergic reactions anymore. The asthma can be better controlled. The runny nose can be better controlled. The downside to it is you got to go to the allergist every week to get your shot. It's kind of inconvenient, but, it's conventional. Insurance pays for it in most cases. And again, it can be effective as a way to control your allergies. In our practice, we don't do that. We do one of really two other types of immunotherapy. One is called LDA, or low dose allergy therapy. LDA was developed by an ENT surgeon back in the 1960s. His name was Len McEwen. And he discovered that if you take allergy extracts, the same one that allergists were using, but diluted out, I mean, hundreds and hundreds of times, way more dilute than what a conventional allergist uses, and then you mix it with a little enzyme called beta-glucuronidase, you can actually achieve the same goal of rebuilding your immune tolerance to these substances. But it's more gentle. I would argue it's safer. There's never been any serious consequence of doing LDA, and now the 60 plus years it's been in clinical use. So I like it for people because it's very safe. It's very gentle. We can use it for children. We can use it for adults. We can use it for older people. There really is very few contraindications of using this therapy. But the ultimate goal is still the same. Again, we're still trying to, ultimately build immune tolerance. The other thing people like about LDA2 is that you only get a dose every 7 weeks. So when you get allergy shots, you have to go every week for at least usually 3 months. With LDA, it's every 7 weeks. And typically it's done as an intradermal injection. So it's a little different than an allergy shot where it actually goes into the fatty tissue of your body. This actually goes just between the layers of your skin. When you get the injection, it's a little painful. It kind of feels like a little bee sting, lasts for about 30 seconds, and then it goes away. What we found over probably the last maybe 8 or 9 years of doing this is that we can also administer it under the tongue. The way that all immunotherapy works are through cells called dendritic cells. Dendritic cells are part of your immune system that really convey that information to the immune system about what you should and should not be reacting to. It so happens that both your skin and under your tongue is very rich in dendritic cells. So the mechanism is really exactly the same. So certainly for a lot of our children, or I have a lot of patients I work with that are around the country where we can't do the injection, we can actually just have them squirted under their tongue, and it actually works quite well.
Hey, Margie here. High-quality supplements are a big part of a comprehensive osteoporosis program. To help you, I offer a significant discount every day in my supplement store through FullScript. FullScript has the most extensive catalog of professional-grade supplements and wellness products I've ever found. So all you need to do is go to tinyurl.com. That's tinyurl.com/supplements for less. And you'll get to my FullScript store, and in there, you'll see my favorite bone building supplements. So make sure to check it out, and the link will also be in the show notes. So let's get back to the show. What have you seen with the people that you've worked with in terms of, improving their symptoms? How long does this usually take, this treatment?
Yeah, so LDA, I tell people generally most people don't have a huge change after their first dose. Usually it's not till the second, third, or fourth dose before they really feel like their allergies are better controlled. Every now and then I get someone, even after the first dose, that said, wow, I know I'm allergic to cats. I went to my neighbor's house. I walked in, and this time I didn't blow up and my eyes didn't swell shut. So sometimes we can see that shift early, but more commonly it's that third to fourth dose before people really feel a change. So if you're getting a dose every 7 weeks, almost every 2 months, it might be 6 to 8 months before you really start to feel like there's been a change. I have some patients, it takes longer. It takes a year to a year and a half. So it is something that you kind of just have to stick with. If you're not seeing that change immediately, doesn't mean it's not helping. It also depends where you live in the world and what your allergy load is. Where I live here in California, pollen is almost year round. We had a lot of rain this last winter. Had we did the winter before, so we had more mold than usual. Now, like where you live out in Jersey, there's no pollen in the wintertime. So your exposure will change that a little bit too, about how quickly you react. So really depending on where you live in the world and what kind of allergy load you have, that probably is also a factor in how quickly you're going to see a response.
So once people are better, do they need to continue treatment to some effect, or what happens then?
Yeah, generally no. I think the general rule with immunotherapy is we want to get you through an entire season of being basically allergy free. And once we get to that point, then we either wean off the treatment or we stop it completely. So, this isn't something that you should have to do forever. It should be for a finite period of time. I find in general that starting earlier in life tends to work faster. So when I treat children, I see a faster response generally than when I treat older adults. Starting at 6 is different than starting at 60. But again, even for people who might be a little older that want to try this, it can still be very helpful. And again, the goal is ultimately to alter your immune system in a positive way that, again, you can be exposed to these different allergens and just not have any reactions. So that means you don't have to rely on the medication. You don't have to rely on supplements, to feel good every day.
Wow, that's really fabulous. Okay, so that's way one. You said there's two
Yeah.
ways, two techniques.
So the other way we do it is what's called sublingual immunotherapy. And sublingual immunotherapy, sublingual just means under the tongue. And although LDA, sometimes we do under the tongue as well, sublingual immunotherapy is probably more akin to conventional allergy shots. So the concentration is more concentrated than what's in LDA. It's still more dilute than what conventional allergists use, but it's a little bit closer in that way. And what's really interesting about sublingual immunotherapy, it's been around for over 100 years. It is the primary way that most allergists in Europe treat allergies. Here in the United States, allergists get reimbursed by doing allergy shots. They don't get reimbursed by doing drops under your tongue. So there's kind of no financial impetus to change that. And it's interesting when you look at the research. I mean, there's over 1,000 studies on sublingual immunotherapy. It's very well researched. They've done studies in children and adults on pollen and mold and cat and dust and dog and all sorts of different allergens. So this is really a very well-studied therapy. And again, it's kind of shocking to me that it hasn't been more utilized in the US. There was a study out of France several years ago just looking at the cost. The cost of doing sublingual immunotherapy is literally 25% that of doing allergy shots. And you would think in the United States, the insurance companies would want to save money, and this could be a way to do it, but they don't. And the criticism of sublingual immunotherapy, the American Asthma and Allergy, the 4AI Society, they're the big allergy group in this country. They wrote a position paper, it was a few years ago, but basically said, look, if you look at all the studies on sublingual immunotherapy and you look at the highest dose to the lowest dose used, there's a 10,000-fold difference. That's a huge difference. That's taking 1 milligram of a drug and 10,000 milligrams. That's a big difference. So they basically said, look, there's such a wide difference. We don't know what the right dose is. What's interesting, though, is that it didn't matter what the dose was. It still worked. Now, the higher doses tend to work better, work faster than the lower doses, but it still worked. So again, the overwhelming majority of evidence is that this is a highly effective therapy. Again, very, very safe. As far as I can tell, and I've read a lot of these studies, there's only been 3 cases of anaphylaxis, and they were all specifically due to pollen allergy doing under the tongue, whereas there's about a 1 to 2% risk of having an anaphylactic reaction if you're getting allergy shots. So it's still pretty low, but I've seen quite a few people in my practice over the years that had to stop allergy shots because they did have an anaphylactic reaction and they couldn't continue anymore. And now what? So sublingual immunotherapy is a much safer way. So again, we still do allergy testing to find out specifically what bothers you. Again, are you allergic to ragweed or dust or cat or dogs or alternaria, hormodendron, specific molds, all that. And that tells us what we need to put in the bottle. Same thing when allergists are doing allergy shots. They test you, they find out specifically what needs to go in your treatment, and that's what you get injected with. I didn't say with LDA, but the thing about LDA that's a little bit different too is that it's a mix that's made by a pharmacy and it's pre-made. So everybody who gets LDA gets the same mix. And there's different mixes. So LDA has a food mix, has an inhalant mix. It has mold and pollen and cat and dust and dog and feather and pretty much anything you breathe in. And then there's a chemical mix for people who are chemically sensitive. So if walking into Yankee Candle Shop or the mall or places that have a strongly scented odors and perfumes bother you, then we can desensitize you against the chemicals. So with LDA, it's really just based on your clinical history. It's not based on any specific allergen, because the idea behind it is like, well, let's say you have 10 food sensitivities and there's 70 different foods in the mix. Well, we covered the 10 and then the other 60, well, who cares because you're not allergic to it anyway. So there's no harm in putting something in there that you're not sensitive to, but hopefully we cover the bases for the things you are sensitive to. So LDA, I'll say, is a little bit more non-specific, where when we do sublingual immunotherapy, now it's very specific. Again, we're only putting in the bottle what we know you're specifically allergic or sensitive to. But the cool thing about sublingual immunotherapy too is it gives us the ability to treat things that conventional allergy usually doesn't. Because we can test you for other things. I find people sometimes they have chemical sensitivity. They know that formaldehyde, phenol, benzene, perfume, cigarette smoke, these things bother them. And conventional allergy, they don't treat that at all. They'll say just avoid it. And the reality is for a lot of chemicals, you can't avoid it. So it gives us that flexibility to be able to treat, I'll say, more unusual sensitivities that might get missed in conventional allergy.
And is this what you do for both allergies and asthma? You use both of these?
Yeah, because ultimately, I mean, asthma really is an allergic response in the lungs. And I think you probably couldn't get a pulmonologist and allergist to agree on that. And there are other things that can trigger asthma that are not necessarily allergic. Some people have exercise-induced asthma. They have cold-induced asthma. It's kind of a chemical reaction that's unrelated to the immune system. But that's more unusual. I think most people I see with asthma, there's some allergic component to it.
So, how many people, Darin, you do this and you've been doing this quite a while. How many people around the country is this common practice for integrative physicians? And, is this something naturopath? Is this something that's common, or is this something that people have to find? How many people are doing this is my question besides you.
That's a great question. It's not a lot, unfortunately. I think if it's something you're interested in, the American Academy of Environmental Medicine has trained doctors for the last 70 years on doing sublingual immunotherapy. So there are doctors around the country and around the world that are trained in environmental medicine that do this as part of their clinical practice. I think what happened when LDA kind of came into play, it became a little bit more popular just because it's easier to manage. And just from a staff standpoint, doing immunotherapy requires a lot of man hours because we hand make everything in the office. We have to mix the dilutions. We make every patient's prescription. So it's a bit more labor intensive. And a lot of practices have chosen it's too much work. But, we've seen the value of doing it. So we continue to use it in our practice. But yeah, there's probably, I couldn't tell you, there's probably 40 or 50 doctors in the US, I'm guessing, that still do sublingual immunotherapy in their practices.
Okay, so I want you to share because you created something with these people who are doing all this interesting work with allergies and asthma. You want to just tell everybody about the summit that you put together?
Yeah, so we put together a summit around allergies and asthma, and we interviewed over 40 experts in the field about various aspects of allergies and asthma. And it's a free online summit that anybody can join. And so we just invite your followers to take a look at it. If you've been dealing with allergies and asthma, or if you've got friends and family, we'll share the link with you, and please pass it along because we want people to be empowered to start taking control of your own health. There's so much you can do that don't necessarily involve coming to see a doctor or even someone like me. There's a lot of things you can do in and around your home. We talk a lot about environmental control in your home, cleaning the home up, reducing your total load. So there's a lot of low-hanging fruit that anybody can do that's free, doesn't cost you any money, doesn't require you to go anywhere. And so again, we really just want to empower people that there's a lot you can do, and again, to have the knowledge of, what more can you do beyond what you've already done with your doctor? There may be a lot of things that you learn about that, hey, this is something I can talk about with my healthcare provider. Maybe this is an avenue we haven't explored. Maybe there's a treatment that might give me better control. Again, my goal for my patients is that I would love to see everybody off medication. In reality, there are some people that have a hard time for various reasons, but we get a lot of our patients off medication. And if we can change your immune system in a positive way and make you feel better, get you out in the world, living your best life, and not have to rely on, taking medication every day, I think that's a huge win.
I love summits because it's sort of like a smorgasbord that people can see the speakers and, oh, yeah, maybe I know, like you mentioned, mast cell. I know there are people on the summit talking about mast cell. Does that have to, and they hear something. Oh, and something clicks. And then they're like, oh gosh, I didn't know about that. And then just as you said, you don't have to change practitioners. You can then take that piece of information and whether you do it yourself or whether you bring it to your practitioner. But that's always when I've done summits. It's just so rewarding because, you choose the people that you think can have the biggest impact and really make a difference in people's lives. And then when you see that they really do, it's just such a win-win situation. So I'm so excited because this is It's very prevalent, these issues. They're not something that affect just a few people. They affect so many. And I think it's really sad, and people don't realize that it also impacts your bone health.
I just want to highlight in the summit, I had two really great interviews. One was Dr. Theo Harris Theorides. He's an MD, PhD allergist at Nova University in Florida, and he is one of the leading mast cell experts in the world. And we had a fantastic talk about mast cell activation and allergy and asthma and how, again, you can really control that naturally. I also had another great talk with Dr. Kelly McCann, who's a medical doctor out here in California. And again, we talked a lot about mast cell and histamine. So I think if you listen to those two talks alone, you would get so much valuable information. But again, all the other speakers, again, most people don't listen to 40 hours of talks. But again, you get to pick and choose the things that really apply to you and what are meaningful to you. And again, we just love for people to join and get that information.
I had Dr. Kelly McCann as well on my summit. And the number she said, I'm trying to remember what it was, the amount of people who have mast cell was huge. It
Yeah.
shocked me. Was it like 30? There was do you know the exact number? It was crazy. It was such a high percentage of people that I was so surprised, something that no one really thinks about, but yet can dramatically, really have major impacts on your life.
Well, we know that about a fifth of the American population has some sort of allergic illness, and that's probably underreported. So the mast cell numbers are probably pretty close to that. And again, it's a lot of people. And again, I think the thing that's frightening for me is that we're seeing more young people, young children having allergies, asthma, eczema, and that number keeps going up every year. So this problem isn't getting better, it's getting worse.
You think that's due to the environment, or what are your thoughts on that?
Absolutely. I mean, our environment isn't getting any better. Our food supply isn't getting any better. And I think, again, the total load that's being put on people, plus we know there's a generational effect. There's a 3-generation effect on the impact of environmental pollutants, heavy metals, toxins. So it's not even what kids are being exposed today. It's the effect of their parents and their grandparents. And each generation, it seems to get a little bit worse. So, we've got to figure out a way to stop this train and slow it down. And again, I think the more that we can control that allergic load, start to change the immune system in a positive way, I think that's going to help a lot of people.
Wow, I love this. Okay, so another question then for people who want to work with you, how can they, work? Can they work? Do you work online with people remotely, or do they have to see you in person? How does it work?
Yeah, I think the pandemic kind of bred that we still do a lot of stuff online. So we work with people in person, remotely. I still have a brick and mortar office. And but we do work with people who, for whatever reason, can't see us in person. So there are ways that we can work around that. So yeah, if people are interested, if they just go to my website, it's just Darin Ingels, ND, and is in NancyD.com. All of our information's there.
Oh, great. I'll have that in the show notes as well. Well, thank you so much. Is there any last minute things you want to share? Because this has been so helpful. And I think the key is to open people up to what is possible. And I think everyone should be open, because this is possible. You've been doing this for a long time. You've gotten people off these medications that have negative effects on your bones, your overall health. And there's another way, and it works. And so I think, and I think it's great that you pulled all these people together for every different aspect, so that, people do have more tools and do have more resources and more knowledge. And I think knowledge is power, and, let's deal with this. But anything else
Absolutely.
before
No,
we,
I was just going to say the same thing. I think the more educated you are about your options out there, I think often there's too much reliance on your doctor, your healthcare provider guiding everything. It's great to have a captain of your ship, but it's also, I think, helpful to be an educated consumer, an educated patient. Know what's out there, know what's available, know what things to bring to your practitioner to talk about. And that's the beauty of these summits, is that it gives you that free opportunity to have all that information at your fingertips. And then you can share that with your healthcare provider and talk about the next steps for yourself.
oh, great. Well, thank you so much for joining me here today. It's always a pleasure being with you. And I just know great things will happen from the summit.
Great. Thanks, Margie.
Wow, Dr. Ingels is just such a wealth of information. I think it's so exciting that there are other possibilities when it comes to how to treat allergies and asthma. I'm really excited for his summit, because I think he has fabulous experts. and then really will bring a lot of information together. So make sure to check that out. The link is in the show notes, and also Dr. Ingels' website will be there. So if this is something that may help you, a family member, or anything else, please share the information with them. So thank you so much for tuning in, and I look forward to seeing you on the next episode.